Hello, everybody. I am the Proactive Caregiver, and I specialize in educating others on how to be proactive by empowering you, the caregiver. Because if you cannot take care of yourself, then you cannot take care of your loved one. And part of taking care of yourself, well, that's setting healthy boundaries. But what do we do when we've reached our boundary limitations? Well, that's usually the time that conversation we've been dreading for a very long time about assisted living and memory care starts to come up more often. And as it comes up, it's real. And now we have to press into this. The problem with this is that we aren't sure of the direction we actually want to go in because there's a lot of fear around this. So today I want to talk about addressing aggressive behavior with medication for those living with dementia in assisted living communities. This complexity of the condition is still being studied. It's being picked apart, but unfortunately, the society that we live in still comes back to medication to manage behaviors. But in most cases, medication isn't even needed. If we spend more time with the individuals who are living with dementia, we can learn so much more about their needs, the sources of their aggression, without jumping quickly to medication. Caregivers in assisted living and memory care communities are already stretched so thin. Today, I invited Dr. Ethelle Lord to join me in this conversation. I wanted her to come in because she just recently wrote some white papers about this very topic, the ratio of caregivers to residents and the aggression that builds because of medication management overuse. Dr. Lord is the founding president at the International Caregivers Association. She is the creator of the Caregiver Partnership Agreement program and has become a global dementia care shaper. With the growing epidemic of dementia and the need for more long-term care communities, we must face the growing problem related to the ratio of caregivers to residents. This problem is what leads to aggressive behaviors and overuse of medication as the solution. Thank you so much for joining me today, Dr. Lord. I appreciate you being here.
Thank you for the invitation. I really look forward to our interview and helping as many people as we can, you and I.
Absolutely, because where I want to help the caregiver from burnout, the family caregiver, you are already doing work to help professional caregivers in this arena.
Yes, and they have burnout just like the family caregivers.
And it's not even thought of and it's forgotten. So before we go into that detail, in a previous conversation, you and I got to talk about how you were a caregiver for your husband for over 20 years.
Yes.
What was that like before taking on this mission of changing the world for dementia? How did that start in your personal side first?
Well, I lived through every possible stages of dementia care, starting at home. And it was very difficult and to a point where I needed to hire people to help me at home. And then it became too difficult and too advanced in his condition to even keep the people at home to do the work that I needed to have done for him. And so I decided to put him into long-term care, which is what usually happens when a person lives long enough. Eventually, you have to go to long-term care.
Right.
So it's a very difficult decision, but it's one that has to be made. What I found when my experience in long-term care is that they had a lot of problems, not enough staff, staff that was not trained properly in dementia care, even doctors, administrators that really didn't know how to speak to family caregivers. I ended up doing all the stages of my care provider partnership agreement program unbeknownst to the institution because I wanted to see if it worked. I was a life coach. I trained as a life coach first, and then a management coach. And then I had a lot of other training besides that. So I used all my training to try every facet of this program, and it improved everything. It improved the care of my husband. It reduced the burnout of employees,
Wow.
uh, families that consulted with me and coached with me felt much better. They felt like they were supported. They didn't think it was the end of the world. All these things came out, and I said, "Wow." So I knew it was a systemic problem
Hmm.
everywhere because my husband actually was in three different homes.
Oh,
The
yeah.
first one because he was closer to his doctors,
Hmm.
and the second one because he was closer to home. But then the program ended, so I had to move him again to a
Mm.
third home. But I found that no matter what the home in those three homes, the same problems existed.
Hmm.
And I really felt it could be addressed better, and that's what I did. And that's how I wrote, first of all, my book, and I wrote this program, and now I'm marketing the program for people that want to do better.
Yes, and that's the interesting thing I found with working with the caregivers at my mother's community. There are caregivers who do want to do better, but sometimes the company or the environment that they're working in doesn't support it.
Well, what I found is the disconnect between the company or administration and the actual workers. I found a
Yes.
big disconnect, and there's no need for that. It needs to be interprofessional, and it includes everyone.
Right.
And when you include everyone and you tie in all the ends and put a health and dementia coach at the center of it, then you're tying everything together. Then they're facing each other and they can tolerate each other because both of them, they have different perspective and they have different goals.
Hmm.
Administration and owners, they have to make a profit.
Right.
Otherwise, they wouldn't be in business. And we
Right.
need that business. There's no doubt about it. We need the business. And on the other side, they want to care for the residents,
Hmm.
and they don't understand when they can't admit more people or reduce the number of people they have to service per aide or per nurse. They don't
Hmm.
understand the difference in that. So really, it's putting everything together and makes a lot of sense in the end, and everybody is better, and including the residents and the families get better services and care.
I agree. And that is one thing that I noticed every time. So you had mentioned your husband was in three different communities. I had to have mom in three different communities as well, but it wasn't so much location. It was more so desperately searching for the location that would actually provide the care and have that consistency between administration and the caregivers so that there wasn't the disconnect. And it was finally the third one that was her last and final forever home that I felt gave the best care because they were all connected and the communication was there. But the previous two communities, majority of the time I worked with a marketing assistant as my facing person being introduced to their community, not anyone who understood dementia to be able to evaluate my mother's needs. It was about filling the rooms and getting residents in house as opposed to being concerned about their care.
I think there are very few homes that you could describe the way you just described them,
It's
because three out
very
of three
rare.
for me, yeah,
Yes.
3 out of 3 for me were lacking. And so I think that the majority are not satisfying to families, and especially for the resident person who's living with dementia.
Right.
It's really totally a lack of education, and then also a lack of manpower. And so
Yes.
my program adds manpower to that facility without adding cost. And that's unbelievable, but it is true. That's exactly what happens.
Right.
And so it's so important to have that. And with the health and dementia coach, then you get the education part that's missing in every home that I was in with my
Right.
husband. And before that, I was a paralegal for legal services for the elderly. I visited many, many homes.
Mm.
I mean, hundreds. And
Mm.
they were, I even cried after I left some of these homes.
Yeah.
I could not believe the people had to live like that to the end of their life.
That is why I believe your work is so incredibly important because There are, after the second home that my mother was in, I realized I really need to do a different kind of dive and research into the home that she's going to next. And so I spent so much time interviewing everyone and as many people as I can talk to, but I kept getting at the front with the marketing agent. So doing any kind of research inside, I realized the way these assisted livings were set up was almost as if I was going to search for a gym. All the amenities that they had and the focus that they had into convincing me why my loved one should be there had very little to do with the actual level of care. And that's why the third one that I found, their level of education is what caught my eye. How much
Yes.
they educated their staff, and not only that they had a higher level of expectation of the staff coming in, but they continued to educate them on a quarterly basis. So as news changed or other courses came through, they interacted with them. And that's where I saw the difference finally, regardless of cost, because that was the other thing. Caregivers are already facing that. First, it's the choice of finally accepting that this transition needs to happen. It's time. And then they're faced with the sticker price of a lot of these communities. But then it's almost the third slap in the face once you get your loved one in these communities. And these significant areas are lacking when it comes to the care for our loved ones.
Yes. I think that just the way you spoke just now, one factor that you left out is the family caregiver. You were the
Yes.
family caregiver and you were the key person they needed to pay attention to.
Right. Oh, that's always, I can't tell you how many times I was treated as if I didn't know what I was talking about, even though it was my loved one that I brought to them. Within so many weeks or months, they made their own assessment and they decided how they were going to care for her. But I continually came in 2 to 3 times a week and said, "You've got to do this. You've got to do that. She doesn't like this. She likes this. She needs this. She doesn't need that." And I was the one that was told that I didn't understand what I was talking about in some cases until I let them know I'm actually a certified dementia practitioner. And then it changed. I knew more than their caregivers on staff. So
Yes.
that's when they
Well,
finally started to listen to me. But beforehand, before I let them know any of that, they wouldn't listen.
yes. Well, I would say what I said is that I'm leaving you with the most precious person in my life.
Right.
And for that, I expect to have cooperation
Mm, at
and
least.
open communication. I want family caregivers to be there every day if they can. I want them to be part of, it's like when he went to the doctor the first time, was diagnosed with dementia. They said he had Alzheimer's. What it was vascular dementia.
Mm,
I say to people, when that diagnosis was made, the doctor didn't realize he made two diagnoses, one
mm-hmm.
for him and one for me.
Yeah.
And so when they go into a nursing home or assisted living, they're actually admitting two people,
Right.
your mother in your case and you,
Right.
myself and my husband.
Yes.
That comes together. And
Mm-hmm.
that's something that's not known very well. I mean, it's not appreciated, it's not known very well, and it needs to be. So that's why the care provider partnership agreement program that's in the forefront, absolute forefront.
Thank you for saying that because that is where the communication started to break down and continued, not just the initial, but the continued communication of the care. How is she doing now? How is she progressing? Why? Are you changing her medications? A lot of times I didn't find out until I got receipts or outside statements from the pharmaceuticals for statements paying bills that, wait a minute, why is she taking this now? Why has this been increased? Why is I didn't have that communication.
That's wrong. That's absolutely wrong. You should have been the first one to be called by the doctor and say, "This
Right.
is what I'm thinking. What do you think? What would you like?" I had
Hmm.
actually fired a couple of doctors because of that, based on
Wow.
that, because I knew they didn't know what they were talking about. One time there was a doctor that came in,
Hmm.
looked at my husband in a wheelchair, and he was slumped over, and he was, in his that's before he had um, energy medicine treatment so that he came back to life. But before that, and she looked at him and she said, "That man has no quality of life." And I looked at her and I said, "My," I said, she came from India, and I said, "Your country is very spiritual in nature, and a comment like that from you, I don't think you're the doctor for him. Thank you
Wow.
for your services." And I wanted, and I finally found a doctor that would do exactly what you're saying, would call me and say, what is your, what would you like here? This might help, this might not. And eventually he went on all natural supplements. Even
Mhm.
beta blockers were removed, and high blood pressure medication was removed. Everything else
Nice.
was replaced, including that, with natural supplements. And see, he lived a long time, very well.
Mhm.
And I was really close to the doctor, and the doctor listened to me, and I listened to the doctor. But I had other doctors that prescribed things, as you just said, would surprise me. Why is that going on? Why is this being administered? And I walked right to the doctor who did that, and I said, "Please don't do it a second time and remove it now."
Wow. I
Hmm.
again, these are the things I wish I knew then, because and this is what caregivers need to know as they're in their situations, that they can actually make that, have that conversation with the doctors and going to them, because in those situations I was expecting communication. I didn't receive communication no matter how many times I said, please keep me in the loop, please let me know what's the changes as they're changing, why are they changing, because I can probably suggest something, or just letting me know that this is happening, because I was trying to track her stages as she was declining. It never happened. It never
No.
happened. And towards the end, I realized in all three of them, I didn't get the communication when medication was changed, because I felt that the changes that were being made were done internally for the purposes of managing behavior. And they were not going to tell me about that. And so that created this feeling of distrust. And that's the problem, where we're dependent on these assisted livings. But how are we going to have our loved ones there if we can't trust the care?
Well, you can trust it if it's under the program that I'm doing, because you would be an integral part of it. You would be a care partner, just like the doctor, just like the
Mm-hmm.
nurse. It's really important to have open communication. And it's the sad part about what you're telling me, and it makes me very sad, because your mother apparently sometimes behaved in such a way that she was
Right.
frustrated, not aggressive.
Right.
But when they don't recognize the frustration coming, and they can't mitigate it with proper communication or actions, then you get to the point, like you said, they want to
Mm-hmm.
medicate them, and that's, to me, is criminal, and it should be stopped.
Right. And in my experience, the medication came in where the ratio of care worker to resident was
Yes.
just ridiculous, in my opinion. When I looked up, um, ironically, I looked up the Texas daycare ratios, okay, just as a comparison. And it was shocking to see from a 0 to an 11-month old, they're required to have one teacher for four babies. When they get a little bit older, to 18 to 23 months, and if we all kind of know what the status of a 18 to a 23-month old mentally, how they are, it's 9 to 1. Preschool, 3 years old, 7 to 1. Preschool, 4 year old, 8 to 1. And I thought how ridiculous and shocking this is when we have people who are living with dementia, and especially when they get to the later stages, late stage 5, 6, and definitely towards the end, you are in this monthly or mental age range. And majority of the places I interviewed, and the three that my mother was living in, there was typically 16 to 32 residents for 1 to 2
Oh,
caregivers.
that doesn't work. That doesn't work. So that's why, at the same time, you have to understand, while I'm listening to your statements just now, it's a business. So they have to
Exactly.
make a profit, okay? So
Exactly.
that's why I came up with a solution that makes a lot of sense. The care provider partnership agreement program adds people so that you can provide more care with less staff. They can have the same staff as they have now, but they'll provide better care because there'll be family caregivers in there included as care partners that will have another set of eyes to look at things and be able to go get some help and get the help that they need, because the people you're talking about, people living with dementia, often have to need changing, they need feeding,
Mhm.
they need also activities.
Mhm.
So they need more people, I agree with
Yeah.
that, but they cannot afford to hire 10 more nurses
No.
or 20 more aides, you understand? But they could easily train good family caregivers that, like yourself, you're young enough to, you could have you could have helped a lot more had you been trained as a care partner through that program and see your mother every day if you wanted to and
Right.
provide some help for her. You see that? So that's as simple as that. It's a matter of, it's a business. It's a business. And we have
Right.
to look at that too, and we have to respect that. But at the same time, you can't do business if you don't have enough people servicing. Remember, your mother left home one on one,
Right.
one on one. And then she goes into a place where there's one for 16 or 16 people for one person. It makes no sense.
Exactly.
So
Exactly.
it's a problem that's systemic everywhere, and I wanted to address that. I know it can change. So it
S-
changes the whole course of dementia care. It's very
It
important.
does. It does. So, can you talk a little bit about how this works for the family becoming part of the care partner program?
Well, the family, not all families, as you know, because you probably have met many
Of
people. Your
course.
mother was right.
Right.
Uh,
Right.
they don't have the capacity, the energy. They're not young enough anymore because they're maybe in their 80s or
Mhm.
90s even.
Right.
They've had a lifetime, but I noticed that when they get older, they move slower. So even the person with dementia care, it's easier to care for them if they're in their 90s, let's say, and the spouse is also in the 90s. It seems
Right.
everything is on the slow, that's a good thing. But now we have people diagnosed in their 20s and 30s
I
with dementia. Those
know.
people have a lot more energy. You see that? So
Exactly.
my program would invite people like myself and yourself that are quite able to continue helping and want to help and have good ideas, know very well everything about our partner or our mother or father,
Mhm.
and they want to become care partners. So those people would be interviewed and trained as care partners. They would have to have dementia care training. They would have to know how to speak Alzheimer's, for
Mm.
example, as simple as that. The different conditions that may develop, and when some person becomes frustrated, what can you do? Um, and know that there's always a coach there that can help you, no matter
Right.
what the situation is. I've had so many situations where I intervene and everything was fine, and I was training at the same time as I was intervening. So those family caregivers, even if it's only 10%, 15% at the most, that's not very many. That's all I
Mm.
need. That would make a big difference.
It
If you
does.
had, if you, oh yes, if you had even five people in let's say the capacity is 40 residents, if you had only five family caregivers willing to do that at different shifts, you would change the whole system. And you have a dementia coach at the center of it. Changes everything. Everything.
And especially having the dementia coach there, that in itself is a huge difference. I Even when I found caregivers that were able to fulfill my mother's needs as they came throughout the day, there
Mhm.
still was a lacking knowledge of dementia. There still was the assumptions that, and not even understanding the difference between, as you said earlier, from vascular to Alzheimer's, and for my mother it was vasculars to frontal temporal. So it these small differences made a difference, and when I got to the point of explaining and helping them, pointing things out, I realized, wow, this could be a totally different situation if they just had a little bit more education, and then they can in turn educate the others and any new staff coming on. And I feel also limit the frustrations, because I couldn't blame them for not knowing something. But at the same
Yes.
time, if they knew a little bit more, then a lot of the frustration of the families, a lot of the misunderstandings between the families and the caregivers, so much of that would have been mitigated.
Well, you would have not only been understood, but you would have been validated, which is very important. And
Yes.
so in my program, the dementia coach is responsible for training from the owners down to the janitors. However, the and training also the family caregivers. They can come up with a question: why is my husband or my wife doing this? Why is my
Right.
mother not doing that? And they would be able to understand, because the dementia coach would be able to educate them and support them and be there for them. That's a tremendous, tremendous
Mm-hmm.
help for the
Yes.
staff, for the nurses. Like, I have a person one time that was going down the hall following me, and he was wanting to see his brother. And he was telling me that, I want to see my brother. And I could see the
Mm.
frustration rising in him. So I came back with him to the nurses' station, and there were three nurses there. And one of the nurses said, well, his brother is dead. And she had
Mm.
almost tears in her eyes. And I said, what was his brother's name? And she gave me the name. And he was pounding on the counter. I want to see my brother. I want to see my brother. I
Wow.
said, let me show you how you do this, how you
Mm-hmm.
reduce the frustration in that person. And I started pounding with him, and I named his brother, and I said, you know, he loves you. You love your
Mm.
brother, don't you? And immediately he stopped pounding.
Right.
Immediately, he changed his whole energy,
He was
and the nurses
validated.
couldn't believe it.
Yeah.
Then he went around with me, and then he sat down. He was fine. So, if you have a dementia coach there, they would have done the same thing I just did. They
Right.
would intervene with the nurses to show them how you do that. And hopefully, the nurses will do that the next time. Another one was a man that was starving. They said, don't go near him. He hasn't eaten for a day or two because he's hitting people. Oh, I said, for Pete's sake, let me show you.
Mm.
Just back off and let me show you what you do. And he had a beautiful smile, beautiful blue eyes. I remember that. And he
Mm.
kept pointing at me like this, pointing. So I started pointing at him until I could touch the tip of his finger. And I sat next to him. I said, please bring his food. And I
Mm-hmm.
fed him.
Connection.
So it's a dementia coach would know exactly what to do. There's no need to get to the point of really wanting to hit people or
Right.
damage something. And it goes to that point because people are not educated. So the dementia coach in my program, all the staff that does actual work, like the nurses, the
Mm-hmm.
doctors, the aides, the activity people, they would be educated. They would receive education on a regular basis, and they would be tested. And the testing is simply to see if somebody in that staff, in that organizational chart, needs to have more coaching or needs to read a little bit more about it or more coaching. That's the only purpose of it. Those people would be tested. Administration and ownership would also receive education, but not tested. But at least they'd have the knowledge, which
Right.
they don't have today. And then you have the kitchen staff, the janitors, and those people,
Mm.
transportation. They would receive education, but not testing either, just so that they're aware. So when they come, a janitor comes into a room
Right.
and somebody seems to be frustrated, they would know
How to
why that
respond.
happens. They could go get some help.
Right. Right.
So, see, the whole organization would be together and have good support and good boundaries.
See, and that's what I found. That's what I saw in our, I'll call it my Goldilocks zone for my mother, the third one, because that's how it was. If a janitor in the last, I think it was the 2 days before my mother passed, we couldn't get the Catholic priest to come in to give her her final rites. It was their janitor that was praying next to her on her bedside because this janitor had become
Mhm.
friends with her as she was
Mhm.
there living, and just everyone was attached to the residents in a different kind of way. It wasn't just this insensitive or cold kind of patient nurse kind of relationship. They were interacting in a familial way. And so it was the janitor in the end that was praying with my mother. And that
Yes,
made a
and
huge
that's
impact.
that's what was needed. You see that?
Yes.
And that's another thing that I noticed when my husband died. I was there with him, but there was nobody to help me after, and I had to drive home quite a distance by myself to come into an empty house.
Mm.
In my program, I want somebody to be responsible for the end of life stage and to stay with the family caregiver to support that person. Do you need a ride? Do you want somebody
Mm.
to go with you? Not to leave them alone, because it's a shock to your system.
Oh,
I don't care how
absolutely.
long it took. It took 21 years but it was still a shock to my system.
Exactly. Exactly. Yes, I even no matter how much knowledge I had at the time, it's a loss, and it was a painful loss. And the process and the people that I interacted with during that time period made
Mhm.
such a big difference in a positive way, and then the lack of interaction made a very traumatic response at the same time. So this is so valuable. And one of the things that I'm worried about and what comes to mind for me is I fear that the necessary changes that need to come about won't actually happen until legislation reinforces this type of program for more assisted living to come about. Do you feel that this type of education should become like a regulated, required form of
It will
education?
be required eventually. I know in some cases we have to go through one of the roadblocks I'm finding is government approval,
Hmm.
because so far they'll approve so many workers per residence, like you said, a maximum of 16 and a minimum of 8. Even 8 people for one person is a lot.
Exactly.
That ends up to be maybe a couple of hours a day per person. And I know very well when I was looking after my husband, he needed more than 2 hours.
Mm-hmm.
Right? So that means
Right.
that they're neglecting people. That's called neglect. And then
Exactly.
eventually it leads to abuse. And then some
Mm-hmm.
people even die. So I think it's serious. I think it's time for the government to look at it. In some cases, they don't have to look at it because the company is big enough. But then the company that's big enough normally doesn't want to sign up for a program like this because they're already doing a good profit. They're big enough.
Right.
You understand? And they hide behind the government requirements of so many per resident.
Yes.
So it's like a catch 22, and there's gonna it's gonna have to change. There's gonna be, like I said, there are some roadblocks to overcome, and which I'm looking at, and there's other situations that are different. I see in some places, in some countries, it's the government that owns those programs, so I have to go through the government, and I have some governments that are showing interest already.
Mm-hmm.
Some other places they have public ownership, and some other it's private ownership.
Mm-hmm.
So everything is handled differently. They could all benefit from a program like that. There's
Oh,
no doubt about it.
absolutely.
Hmm. They
Absolutely.
could do better financially. They could do better with no burnout, less burnout, better employees, and they could go and do better in recruiting because it's hard to recruit when the reputation of the organization is not
Oh,
good.
that is so true. And I don't think they realize that when the turnover is what it is, that the idea now, before COVID, the idea was go ahead, leave. We can replace you. There's plenty of people out there. But caregivers, especially professional caregivers, during COVID were beyond burnout. I mean,
Yes.
there was a lot of the mass exodus of caregivers once everything was said and done and people were able to leave the profession. uh, that's become a difficult issue because that's what I heard from the second place that I had my mother in was they couldn't find good quality people. They couldn't find enough. But then I thought, well, your reputation is what's out there.
Yes.
That's why you can't find good quality people because your reputation has tarnished. Because I believe there are plenty of people out there who are capable of doing the caregiver job, who are open minded and have the open heart to even learn more educationally so they can do their job even better, especially if it means they're certified. Maybe they'll get paid more by the hour. But when it comes down to it, that reputation tarnishes the company. And that costs them
Yes.
more money in the long run than just paying for a
Mhm.
program that would actually build their reputation as a well known community that has educated caregivers.
Right. Workplace satisfaction is extremely important. I can tell you for sure, that under the provider partnership agreement program, people don't want to leave.
Right.
I usually like to say, expect to let release at least 10% of your workforce a year.
Mm-hmm.
Um, my doctorate is in management, so I say it's safe and it's also healthy to do that. However, under my program, it's going to be difficult to do that because they'll be so satisfied. Imagine the nurse
Right.
that's puzzled or the doctor that doesn't know why the patient, when they went into the room, the patient was swearing at them and calling them names, and they don't understand that, and they feel that they don't want to continue doing that, and they can come to the coach, and the coach can explain what's going on.
Yes.
One time I
Yes.
know that there was a woman that was swearing quite a bit and calling people names, and a terrible, terrible situation. And one person turned to her and said, there was a visitor, turned to her and says, when I grow up, I want to be just like you. And that just stopped that woman from swearing and abusing other people because she found that to be funny. So it's when you know what to do, it's a lot easier, and people would not want to leave. And it's not always money that keeps people. That you'd be surprised how low on the requirements. For example, job flexibility is more important.
True. That is very true.
Yes, yes, for most people. And so, in a system like this, under this care provider partnership agreement program, all that is being considered, and you would keep your people.
Ugh. And it makes a huge. I saw a stat the other day that by 2030, so currently we are at, I think the ratio is 7 to 1. So family caregivers right now. And by 2030, it's going to be 4 to 1. This isn't going away. The need for assisted living and memory care is rising.
Growing, growing.
It is, and that's why I feel this. I've referred to this growth in dementia. People living with dementia is almost an epidemic of its own because it's on a global sense. It's not just the United States, it's on a global sense. So when this, once your program continues to be applied around the world, what do you envision for the International Caregivers Association going forward?
Well, going forward, I really want the International Caregivers Association to become almost like a funnel where you come in and you are directed to the proper way to care for these people with dementia. Do you know that 80 to 85% of people in long-term care, whether it's assisted living or nursing homes, at the moment is 80 to 85% are have some memory loss.
Of
And
course.
so it's so important to get that knowledge out there and that training and that support. It's a
Yes.
support that I'm really pushing for. And so I see the International Caregivers Association on being the association that brings everybody, the world together.
Yes.
Now, I remember in China last a couple of years ago when I looked to China, uh, they didn't care if a person came in to take care of their loved one that had dementia for 1 hour or 2 hours, and if it didn't work they would let that person go, but they could replace them immediately because China
Mm.
has so many people.
True.
But
True.
today China, even in a couple of years, today China is starting assisted living and nursing homes. They didn't have to do that before because they could bring the people in the house, at home care.
Mm-hmm.
And now it's going out of hand. There's too many, and of
Mm.
course the younger people are working. They just can't do it. It's
Yeah.
a 24/7 job. Who can
Uh,
do 24/7 for nothing?
No, right. And still work outside of the home and make an income
Yes,
to support the
yes,
family. It's not doable.
yes. And so I see the International Caregivers Association as the source where people want, if they want to do better, they
Hmm.
want to make more money if they're a business, they want to keep their people, and they want to train them properly, and families can trust them because
Right.
you always have to survey those facilities. At some point somebody's going to call you and say, what do you think of this and that? And so the surveys would be better. Right now, if you look at surveys of all the nursing homes and assisted
Hmm.
livings, and even in the United States here, you'll see they're not that good. That's
No,
because the services are not good.
exactly.
That would improve, so that so the public perception would be improved, and would be easier to find a home near you, a place nearer the
Yes.
family.
That's another problem. When I was looking for the proper home, a good home for my mother that had all of the I made a list of 10 things, and if they could cover at least 6 of the 10 things, then I would consider them and put them in my list of who is going to be the one that wins my mother, so to speak. But at the end of the day, driving all over town 30, 45 minutes away from my home to find something that was in the area that was and happened to be in the area and a good place for her and she could afford it. There was so little. There was just so little
Mhm.
that was there. And when I went online to read reviews, oh, it was
Not good.
scary. No, it was not good.
Scary.
Then it really whittled down the area that we live in to very slim pickings.
Right. Right. Now, there's a lot of examples I could give you that probably would scare people, so I don't want to scare anyone.
I
But
know.
it's very, very serious. The amount of neglect and abuse that's going on, and even those that I
Yes.
see go as far as death, it's unnecessary. It
Yes.
could be avoided. People act as if they don't know what went on when they should know everything that's going on.
Right. See, and this is the delicate area that we're in because, as we said in the beginning, caregivers will eventually come to this point of their care journey where they need to transition their loved one. They have hit the boundary. They are not physically capable of doing it anymore. They're not emotionally or mentally capable of doing it anymore. That's the problem because we are dependent on this. And until communities make these sorts of changes so that it's a cohesive environment and it is at the best for not only their residents that are there, but their employees, for everyone there. You remove the hostile work environment, you remove the distrust.
That's right.
If it comes down to, do I spend more money on training or do I spend more money on food? For because that's something that I feel when it comes to cutting costs, they cut costs on food as opposed to training or labor force. There's so many of these details that need to
Well,
be ironed
I
out.
have good I have good news for you because it would cost them less, not more. It
See,
would cost them less to have a better education because
exactly.
it would keep their employees. Do you know how many $1,000 it costs just to have somebody work for a few months or a
Right,
year and then they quit?
right.
Very expensive, very expensive.
Right.
So this would save them money. That's what I'm saying. My program would save them money and you would
Good.
have better care. And of course, the food would continue to be good if it's already good, but it needs to improve because I watch what they feed people too,
Mm-hmm.
and people with dementia should eat nothing but the best and mostly plant-based
Right.
and so on and so forth with their vitamins. Um, and that's not what they're getting. They're getting donuts for a break or a
Mm-hmm.
soda for a
Mm-hmm.
drink. So those are that's expensive. We
Yeah.
could do better, much better, and my program would show them how to do that. Anybody that wants to do better, they just need to contact me.
So that's a perfect segue right there for those companies that are out there who are interested in your program because they do want to do better. They do want to increase their bottom line by investing in their staff. How do they contact you and where can they find your program?
Yes, they can go on the internet and look at dementiacarepartnership.com, dementiacarepartnership.com.
Okay.
They can also call my office. I have two offices, one in Maine and one in California. I'll give you the main number first. It's 207-764-1214. The California number is 760-660-4460.
Wonderful.
And they can also contact me via email if they want to use the email at Lord Ethelle, Ethelle, at gmail.com.
Perfect. Thank you so much for sharing this information with me. I cannot say it enough. I really do wish I knew this was available and that this type of education was out there because I would have advocated for it in the communities that my mother was in. But thankfully, we found one in the end that had something similar. And I feel that they can still learn. They can still learn because as this world of dementia evolves, there's so much that all of us are having to learn and understand.
Very good. It's true. Thank you.
Well, I appreciate you for sharing the time and the information with me today.
Thank you.
All right, ladies and gentlemen, thank you for joining and listening today. I hope this episode gave you a lot more food for thought when it comes time for your journey transitioning to assisted living or memory care. If you want more episodes like this, you can also go to theproactivecaregiver.com and on YouTube. Be sure to hit that like and share. But until next time, be proactive. Take care, everybody. Thank you for joining today. To find out more about becoming a proactive caregiver yourself, visit proactivecaregiver.com and subscribe so you never miss an episode. Music provided by www.joystock.org. The Proactive Caregiver is produced by Canon Light Media.